A very good evening, dear friends. Myself, Dr. Sandhya Saharan, gynecologist, past president of the Thane Obstetrics and Gynecological Society, and honorary joint secretary of the PCOS Society of India, will be moderating this discussion along with Dr. Priyank Patel, who is a spine surgeon at the Jupiter Hospital, Leelavati and Vish Candy Hospital. He also has his own NGOs and he's also attached to, I think, our spine, right?
We are spine.
We are spine. Okay. So that's great. And this platform is being hosted by UMANG. UMANG was created by like-minded medicos coming together for expanding their horizons beyond the limitations of professional learnings to start a different kind of a CME, that is creative medical evolution through various insightful, inspiring, and interactive online sessions by medicos on non-academic life skills. Across the entire medical spectrum, from medical residents and young doctors to senior-most doctors, public and private sector, doctors from all specialties have been a part of this movement for the last 2 years. In fact, today is the 31st session, and we also have a YouTube channel with the same name, Umang. So I welcome you all. As we all know, fitness is a huge obstacle race. All doctors face the dilemma of initially struggling when they're starting practice, family, later on lifestyle diseases. So it's always, something which is on the back burner. So to help us to clear the path and in this fitness endeavor, we have an esteemed panel. Foremost is Dr. Padmavati Menon. She has been our teacher. She is a retired head of Department of Endocrinology from the Seth GS Medical College and KEM Hospital, Parel. Madam has 108 publications to her credit, and she has been the chairperson of the Ethics Committee of Seth GS Medical College and also NIRRH. We have with us a very celebrity nutritionist, Rajeshri Gadgil. She is the founder of True Well, and she is also the CEO of RSG Nutrition and Healthcare. She has 20 years of global experience in various countries, New York, and also in many European countries. She is an MBA in marketing and master's from Sion Hospital, postgraduate from Symbiosis, and a certificate course from Stanford. I think she'll be giving us a lot of insights with her tremendous experience. I hand over to Dr. Patel to introduce our other two panelists.
Thank you, Sandhya. The other two panelists are my dear friends. One is Chasnal. Chasnal is Dr. Chasnal Rathod is a decorated pediatric orthopedic surgeon. Apart from all the accolades that she has had in the field of pediatrics and having trained all around the world, that's not the reason why she's here. Not a lot of people know that she's a multifaceted personality, and she's actually, done Formula One racing and all other extracurricular activities. And we are going to have her here as an orthopedic surgeon telling how we should get fit for doing all these activities. The last panelist with us is Dr. Goresh Kenkre. Dr. Goresh Kenkre is a senior orthopedic and neuro rehab specialist. He is the chief physiotherapist for the rehab facilities set up by Lupin Group. Apart from that, he is also a chief physiotherapist for the Spine Foundation, which is doing philanthropic activities all around the country. He has treated the likes of tribal patients. Along with that, he's also treated doctors, athletes, and actors. So he's going to give us a perspective on how to prepare our body to enter into the fitness regimen. So with this, I hand over to you so that we start off with our session.
So great. We have such an illustrious panel. I think the CV itself speaks for our, desire to get fit. So I'll address the first question to Dr. Menon. She is herself an exercise, I would say, exponent. She exercises more than 1 hour daily at this age. So I think we all take an example from her. Madam, given this present day scenario, where there are so many problems and all kinds of we would say even thought blocks to exercise. How would you approach this situation right from the beginning? Somebody gets up one fine day and says, okay, today is the day I'm going to start exercise. So what are the prerequisites? What are the health checks, if at all, motivational goals and a roadmap? If you could just start off with, how does one start?
Well, you need to start right away. The only recommendation which it comes is when you are starting late. For example, I started my exercise programs much later at the age of 45. And first thing, one of my students who's cardiologist told me, Madam, go and get your stress test done. Make sure you're on. So when you are starting late after the age of 35 or 40, yes, you need to do a cardiac checkup. And if you are starting early and you have been doing exercise for a long time or taking part in activities, you could start anytime. The second point is that you go slowly. There is no reason to reach like tomorrow. You start with small steps and keep on increasing your activities according and increase your stamina. And as your stamina increases, keep on increasing the exercise. So that is something which you need to understand. And most of us, I mean, when we advise exercise as an endocrinologist, it's mainly to remain fit. It's not for bodybuilding. That's not our aim. Our aim is to remain fit and lose weight all the time. Now, losing weight is not exercise prone, it is nutrition mainly which produces losing weight. However, exercise helps in the muscle and various metabolic processes are helped by exercises. And goal, yes, you will attain your goal, but if you're depending on your goal, if you're going to remain fit, yes, it is reached very, very soon within 1 or 2 months of starting exercise and gradually increasing, you will reach. But if you have weight loss as your mind, then diet, exercise, it will take some time before you reach. And the weight loss is going to happen only after 1 or 2 months of diet and exercise. It's not going to happen overnight. And then, most important, weight loss is never a permanent thing. It keeps a little bit of variation, and you may have weight loss coming up much later also. So you have to be patient.
Excellent.
So, ma'am, when you said that you are not recommending exercises for bodybuilding, like, is there any particular exercises as an endocrinologist you would recommend for someone who's very lazy and does not just want to do that bare minimum? What kind of exercises would you recommend?
You can start walking. Walking is a very simple exercise. For example, we have patients who is 70 and 65 and all. You can't tell them to start overnight exercise. So what I tell them to do is, what do you do at home? For example, simple Bartan Manjne ka, that's a good exercise for the hand. Then if you have your washing machine and you're putting the clothes on, I tell them walk from washing machine with one cloth to the railing, come back again, go again. So that at least that much of walking will gradually increase. So it depends upon how much you have been walking and how much you can do. And so gradually increasing. There is no limit to how much you can do. But at the same time, you should, the major thing which I advise is to never get hurt. No exercise should hurt you and prevent you from doing further exercise. So that is very important for telling our old people. There are many people of some of my patients who are willing to join gym after the age of 45, 50 also. Then tell them to take a cardiac checkup and then join the gym. So you could start with small steps, but you must keep on increasing.
Correct, correct. That's an excellent point. In fact, it's seconded by the longest living population in the world, the Japanese population, which actually propagates that exercise is not good. Don't overdo things for your body. Just do your own activities like the daily chores on your own, and that is good enough for your body. The other point that you told is very, very pertinent. Especially in the lockdown, we orthopedic surgeons have seen so many people who have been injured because of trying to get fit on their own. So, Chasnal, I would like to get you here. Can you tell us as an orthopedic surgeon how to prepare our body for getting fit? Like, what are the bare minimums that we need to do? And then maybe, Gaurish, you can hint at some exercises uh, before we start the real fitness program.
Yeah, so I think it has very well been stated by ma'am also, that we just can't start suddenly, all of a sudden, very vigorous exercises. So if we plan for some with a goal or how to go about it, I think the first and most basic thing is that first we get our nutrition in place, which of course we'll be discussing further. And we start with basic exercises like first walking and warming up, and then gradually build it up over the week. So maybe the sessions or the kind of workout which is planned can be a basic cardio workout to begin, few sessions, and then a HRX or a more intense entire body workout, followed by more focused workout. So suppose if somebody is planning to go for some particular sport or maybe a trek, in that case, they should focus more on the cardio, the breathing, and they can give one day for yoga and do the pranayam and build the training that way. And more intense, after 2-3 months, the best thing would be to do resistance training. So based on what we are planning or what kind of activity we are looking through for over the months or what are our targets, I think a graduated and a well good it's like a module which will cover entire body cardio as well as localized strengthening would be a good way to go around it.
I
Perfect.
request the participants, some of them, I think they have a lot of background noise. So if there's a background noise, then I would request the others to just keep their systems on mute, because we are not able to hear the panelists. Now, Dr. Gaurish.
Yeah. So, as rightly said by Madam, and so first of all, we need to know that there is no magic when you go for fitness goals. So, it's about patience that you are going to achieve your goals. So, there is a lot of patience which needs to be there when you prepare for your exercises. Uh, Whenever I think there is some noise coming from.
Yeah, background noise.
So,
Yeah, we've just muted that.
So, most of us, again, when we go for exercises, we directly go in the plan or regime of exercises and we forget about the warm up and the cool down phase. It's very important to do a proper warm up in exercises because your muscles need to be supple. Otherwise, what happens is if you suddenly do any exercise, you will overstretch the muscle, which they are not ready for, and you may end up injuring the muscle. So that is, it's very, very important to have minimum 8 to 10 minutes of warm up as an exercise. Also, if you go by the recommendations, American Heart Institute actually recommends around 150 minutes of exercise per week, aerobic exercise like walking, maybe jogging, maybe running. So 150 minutes, which comes to 30 minutes per day. So which is advisable for all healthy individuals above age of 35 to 40. So as a routine, you should kind of take that into your regime. Also, when you do these 30 minutes of exercises, 2 to 3 days of good low intensity or moderate intensity strength training is something which is recommended to be fit. So if we are considering about a fitness program, this can be included as an program when you start with.
Great. So you recommend like 3 days of strength training, 2 days of cardio together in a week should be good enough?
So cardio wise, ideally, what is recommended? Ideally, what is recommended is 6 days of cardio, but not kind of 40 minutes or 60 minutes of cardio. You do 30 minutes of those exercises of cardio, and rest of the time, alternate days, resisted training is recommended.
Superb. And madam had suggested, like, the simplest exercise form is just walking. Lot of times, like, we start getting into fitness after our 40s, 45, 50, and almost things like osteoarthritis of the knee is given at that age. So, is it advisable to get directly into walking and cycling and, aerobics, or do you need to first do something for your joints, prepare for those activities?
Right. Yeah, so walking can be taken easily as an exercise, that's true. But yeah, so when you get above age of 40, 45, most of the people nowadays come with complaints of knee problems. And ideally, knee any weight bearing exercise is not prescribed for the knees. So you have to actually, if you are kind of starting with a new regime of exercise, then some amount of history or some amount of this thing is important, that what problems have you faced prior. So if the person has already faced some knee problem, then non-weight bearing exercise is something which is more better than weight bearing. Walking comes into the weight bearing category, though it's low intensity. So ideally for somebody who has had issues of knee but not investigated, exercise which would be recommended would be ideal exercise would be cycling, but otherwise just investigate, find out what problems they have. They can start walking, but good initial strength training is important for the quadriceps muscle so that you unload their knees.
What about
Fantastic.
I see a lot of, these older people. I mean, not exactly swimming, but they have a lot of these water exercises like non-weight bearing, like you mentioned. So nowadays it's becoming a big fad in many of the places, even abroad. I'm seeing, they have these groups and then you have a trainer and they teach them, whatever, aqua aerobics and all that. So what is your take on it? What experience have you seen with that?
So that's a really good distinct, that water therapy actually is coming up as one of the main things for exercise regimes, because of the buoyancy effect of water, there is very less load on the joints, and water therapy can be considered as the starting point for your exercises for people who are above 45, 50, and they are starting, because it is absolutely safe to do water therapy. There is no load on the muscles. But again, the problem is the access to the pools. So main thing is people should have access to the pools. If there is a better access, definitely that's recommended, and it's really good to have water therapy. But there is one more issue with it. What happens is there are something called as aqua aerobics, as you spoke about. So when you start water therapy also, you cannot go aggressive. A lot of people come up with those water dumbbells, they push the dumbbells, they do a lot of running, jogging. Those things have to be graded strengthening. So you cannot directly go in the water and start running and jumping. So you have to use the effect of buoyancy, train your muscles, and then get to those kind of high intensity aerobics.
Okay, so that's very important, that everything has to be in a moderation and it has to be, baby steps, and then we go on to the bigger ones. So coming to Rajeshri, you need to unmute yourself. Rajeshri, now we have all, especially being a gynecologist, I have women all the time. The first thing they say is, I have backache, I'm anemic, I have this, I have hypothyroidism, all kinds of things, So how do you treat? You must be getting, we generally refer to the nutritionist, that dietary deficiencies. And do you have a customized plan for like people with different comorbidities, or for, the obese or the thin? Like, how do you calculate the calories? How do you approach these people?
So I'd like to also add to the earlier question, which when we were talking about fitness, it's how the recent studies actually showed that 60%, and this was conducted in Bangalore, where there are so many hospitals, that about 60% of doctors there have a sedentary lifestyle. I think we probably here in our areas are more active, and we see so many doctors doing so many things. This is the case, and if the sleep patterns is only 6 to 7 hours, then it's a professional hazard, of course, for us medicos. And then in that case, any exercise is the good exercise, but we need to go slow and steady, as most panelists recommended here. And we do at our centers recommend people doing a mix of alternating between the high and low intensity exercises. What this really does is the high intensity ones, also when you're doing stretches or if you're doing weights, it kind of helps those low intensity exercises also. So that benefits, plus you get breaks between your high intensity cardio. So that's another very essential thing when you're starting with your exercises. And most importantly, I think our exercise regimen should be mindful. While it's physical full body, it is also supposed to be, it has to have that happiness around. So I think these are aspects also which we should add. And we should start with breathing and maybe end it with yoga or shavasans, because these are the ones which actually really take us through these hectic routines. And if we are going to start with any of those marathons, or we're going to start with a lot of these bigger things that we want to do. So having said that, Dr. Sandhya, you actually addressed the the right main issue right now. Especially in women, we have obesity, PCOS, menopause. Menopause is each of them give different symptoms to women, and so there are recommendations, in general recommendations that I'm going to give here, but of course personalization is really the key. So what we recommend people to do is, of course, first assessing their health parameters, and also then assessing their nutritional status, because a lot of them and a lot of us we don't do the assessment. So assessment really is the first step. And what we see is these issues like obesity, PCOS, they also give rise to other comorbidities, like we have diabetes, we have dyslipidemia, higher blood pressure, etc. So in these kind of situations, of course, the main assessment is we see that people are not eating balanced diets. So the main thing is correction in terms of that. Protein, everyone is talking about protein, but when to eat the protein, what to eat the protein with, all these things are extremely important. And moreover, after eating all that, how much of that is really how much of uptake is really happening. So we of course do customization, trying to first understand what the individual is going through, what are the different comorbidity patterns that the patient or the doctor friends that come to me, we assess that, and then from there, then we start recommending what meals to eat when. So diets like there are so many fad diets today. Keto diet is not a fad diet when it comes to a shorter period addressing certain diseases, but there are endless number of them. And if we should eat twice a day, or we should eat every 2 hours, is not really the thing. We really need to find out what are your work schedules. There could be some doctors who are probably working night shifts. There could be some doctors who start early, or some doctors who finish late. So based on that, we really actually design our meal plans, and the meals are balanced in terms of course, proteins, carbohydrates, fats, and fiber, and everything, and our micronutrients, but also a balance in acidic and alkaline foods needs to be done. Maybe I can add more to it later.
So Rajesh, just like if you have to inner line tell us, I'm not a patient. I just want to ask you that, okay, when you say well-balanced diet, so what do you mean by well-balanced diet? What are the macros that everybody need to watch into?
So honestly, though carbohydrate is the major component of our foods, what we really, really need to stress on is to be eating proteins, and eating proteins again from various sources. So you should eat proteins from non-veg foods if you can. Through fish is a good source. Egg is a great source. So, and apart from that, of course, chicken is also a good source. So these are good sources when it comes to non-vegetarian foods. But Indian population, our non-vegetarian patterns are just, we eat non-veg when we feel like it. Non-veg is not a part of our nutrition routine. So we need to really stress on the vegetarian proteins as well, which comprise of dairy. And I do think dairy is extremely important, though people have reservations about milk and so many other things. But we have paneer, we have tofu, we can drink buttermilk. All of these are good sources of protein which we should rely on. And apart from that, there is a lot of noise on plant protein right now because people want to go vegan. But what is important at the bottom, basic line, is that the amino acids that we are getting out of it are the crux, and the sources are important. So I would stress on proteins. The second thing I would also stress on, which I keep talking a lot about, is the enzymes. Are we really getting enzymes from the foods that we're eating? Because whatever we eat, if all those nutrients are not digested and not the uptake is not good, then it's not going to be very useful. don't stay away from fats as well. Good fats are extremely important. We have good fat deficiency, I would say, and that good fat deficiency gives rise to vitamin D deficiencies as well, because whereas how will the uptake happen, because it's all fat dependent vitamins. So.
And what about supplements? Any particular supplements that you recommend everybody to take?
I would not give a blanket supplementation. It really has to be assessed. But yeah, I mean, what we normally observe, and in cases of people who are 35 plus and where the inflammation has set off, and especially when we are doing sports workouts and fitness, I really recommend anti-inflammatory supplements, and we have a lot of good supplements there. We do have glucosamines and MSMs from the modern research, but also we have a lot of herbals. So we have boswellia, we have turmeric. All these have to be taken. A good anti-inflammatory diet, which is extremely tricky to design, needs to be done with the supplementation.
So at this moment, if I can pull in Menon, ma'am, from an endocrine perspective, do you believe in supplements? Because there are a big group who says that the entire business of supplement is a big sham, and if you eat well, you don't really require any additional supplements. And in fact, a lot of people do say that supplements can have a long-term problems, which maybe you see in your clinics after people having overdose on supplements. What is your take on it?
See, to be very frank, one must understand both the subjects which we are discussing today, lifestyle and supplement, diet and exercise. Both of them have no evidence-based medicine. Extremely difficult to get evidence for anything to say that, okay, you eat this and this is going to happen. That doesn't happen. Number two, what do the international standards for like ADA or European guidelines or something say? Very, very clear. Food supplements are not recommended for diabetes. We're talking about mainly about diabetes, but FDA says that no food supplements are advised. Why? If you think that a supplement is going to produce an effect in terms of disease cure or anything like that, then it has to be FDA approved medication. It becomes a medication then. So you cannot do that. So no food supplements are advised. Initially, they used to say you can give vitamin E, you can do that. But ADA has now come down. If there is deficiency of vitamins, treat them. If there is no deficiency, no even vitamin supplements are not to be given. Why? Because these vitamins have never been properly conducted research and they have come into the market. They have come into the market just like that. So at least in vitamin D, a lot of work has been done. But B12, some work has been done. But most of the vitamins people have been taking as supplements, no work has been done. And why did we open our eyes to it? It happened because of B6 neuropathy. Several years back, B6 neuropathy came to be known because in tuberculosis, people used to give large amount of B6. So that is the time when people open the eyes and says that no, they are to be given if there is deficiency. If there is no deficiency, not to be prescribed, because we really don't know the adverse events of any of these vitamins. We only know vitamin D, B6, certain things, but we don't know. The other thing which is important is that these food supplements do interfere with your daily life, and it also interferes. For example, they also interfere with medication, and in some of the tests, for example, the B1 which is given interferes with thyroid test and gives all kinds of abnormal thyroid reports. In short, before doing a thyroid report, I tell them, if you're taking vitamin supplements, please stop it for 3-4 days and then only do the thing. Why? Because the B1 which is there is utilized in the kit as one of their chemical agents for the kit preparation. So it really interferes and gives you can get high T3, high T4, high TSH, you can get low T3, low T4 and TSH. So you don't know where it is going. So I am very much against food supplementation. Even for example, in our stroke patients, dietitians have a habit of writing, give this supplement. But I personally feel that whatever is a diet which is planned in terms of balanced diet can be given mixed, pulverized, and put through the Riles tube. Why not? A stroke patient is not going to eat everyday supplements, and that is an additional cost in addition to various other things. So they can eat natural food which is there. Another thing is that from 1972, I'm doing diabetes. And so many diets have come and gone. Like she says, so many fads have come and gone. And finally, everybody, ADA, European Association, Indian, everyone settled to one thing. Total caloric restriction is the best way to manage all those disorders. And then patient has a lot of choice to eat what she wants to eat, except that caloric restriction has to take place. So for me, a dietary supplement is no, unless of course there is a reason. So some disorders where patient cannot absorb, and there are several malignancies and other disorders, so pre-digested or other food may be given for those temporary times. Yes, there it is advisable. That's how the food supplements came into the market, and now it has become everybody prescribed.
So,
So,
madam,
ma'am, can I ask a
yes, I think
question to
Dr.
ma'am?
Chasnal wanted to say something.
Yeah.
Yes.
So,
Yeah.
ma'am, with the new wellness centers in vogue and the IV treatment and all the gym goers taking creatine injections, and it's like rampant without any prescriptions, what would you say about that? I mean, they do say there are recommendations for taking creatine injections, but are they really safe? What people who vigorously work out they take? So
There are absolutely no recommendation in terms of medical, what we talk about evidence-based medicine. No recommendations at all.
No.
In short, we have seen the worst end of the thing because they also take creatinine, proteins, and
Yeah, the
steroids and
creatine
various other things. And when they
injections, yeah.
take that, they have an HPA axis suppression. And then when they want to have a child now, and they want to do that, the HPA axis is not going to respond when you want it. It will respond at its own sweet time. And if you have suppressed it for a very long time, I have a person who's going from one person to another, and I told him there's no point in visiting 10 endocrinologists because that HPA axis suppression cannot come back for it. It will take its own time. When we don't know, 5 years, 7 years, the HPA axis suppression would not come, and he had to be replaced with small amount of, like we treat pan-hypopituitarism, we had to treat him with steroids. So it's a very sad thing when that happens, and hence no supplement should ever be taken. And yes, you can increase your protein intake or something, but I have to ask one question here to everyone. All of us are doctors. We know for a fact that proteins can be converted into carbohydrates and carbohydrates into fats in the body. So a body is faced with a problem that I only get a carbohydrate diet. Do I stop making proteins? Absolutely no. For a few days, if I only take carbohydrates, my body will still make carbohydrates because it knows how to convert carbohydrate into protein. Yes, there are certain essential amino acids, and prolonged deficiency is going to create a problem. But I personally feel that uh, general principles which the dietitian gives, yes, very good. But after that, to insist that you have to eat so much of protein per day, Indians don't eat that much of protein from time immemorial. We don't eat that much of protein. I think if we have done well, it should be okay. I don't think that much of splitting hair should be done in diet. Again, I come back to the same thing. There is no evidence-based medicine in any of these things because you cannot give some people extra protein and see what happens. Then you have to look at their genetic aspects. You have to look at so many other aspects. So they are very confounding results which you're going to get.
Madam, what happens is now this is a
No,
quick question.
I think the dietitian has to come in. Let her come in.
Yeah. We'll just finish with the main thing because everybody wants to know the main burning thing is core strength, muscle mass, strength training.
Okay.
Like everybody to touch on this first because this is what
Okay.
everybody wants to hear about. So quickly from all the panelists, all your takes on these, exactly the dynamics and like what is which and how does one go about strength training.
So if I can actually contribute a little bit here because in the lockdown I had a mess when people were treating only the bad problems like tumors and infections. I had to actually rush to the hospital because a young person had suddenly locked the bag, or so all these used to happen. So there is a big misconception about exercises. Let me start first with the famous 10,000 steps. Let me tell you, 10,000 steps is a big sham. There is no evidence which says that you need to walk 10,000 steps to keep healthy every day. That's a way. That's exactly like what it happened with diamonds. Diamonds are forever is a big sham. That same way, 10,000 steps
created
is something
by the market, no?
Exactly. It is to sell these smart gadgets, the smart wristbands to calculate
Smart
your
watches.
steps. Exactly. So I don't want to name the company, but that's where everything started off with. The next part is the other part is gym, weights, dumbbells. No, fitness is not equivalent to having biceps and triceps. You have to
Yes.
understand the concept of how a
Yes.
body functions. There is something called as gravity muscles and there is something called as anti-gravity muscles. For example, God or nature has designed humans in a certain way. Your triceps are supposed to be stronger than your biceps. But when someone actually goes to a gym and isolates the muscles and exercises, invariably what happens is that the biceps become stronger than the triceps. So you generate a body, a very fit body, but that's not physiological. And long term, you have adverse effects on the joints. So just think about it. What is fitness? Fitness means that you amplify or you optimize your activity of daily living. And when you are going to a gym and taking a dumbbell in your hand and you're doing this, okay, that's actually isolating the biceps and doing an activity. And mind you, in your daily life, you never do this activity. So there are so many different exercise forms. So we had a question stating that is it mandatory that you need to go to gym and take weights? No, it's not mandatory. Yes, strength training is important, but that does not just happen with weights. Even a basic exercise form like yoga can increase strength. You have to understand how your body is going to work. So you, like what Goresh had initially said, that you need to do some form of cardio activity. Now a cardio activity works when your heart rate is at 120 for a minimum period of 30 minutes. So something that is something that is going to be ideal cardio activity. When you're talking about strength training, it can be basic things like HIIT, which is called as high intensity interval training. It's a combination of burpees, squats, push-ups, core exercises. So the concept is there are different muscles of your body. Core muscles are very important to stabilize your joints. So whenever you are in an exercise form, you need to start strengthening your core muscles, and there are something called as mobilizers. So in fact, because Dr. Goresh is here, I would like to pull him here and explain to us the different muscles of our body, what are their functions and how we should train them.
Yes. So that was nicely explained by you, Dr. Priyank. But yeah, there is a big misconcept about what are core muscles. So conventionally or traditionally, we used to consider our rectus, like we used to do a lot of crunches for back pain. We used to do a lot of back extension for taking care of back pain, and we used to consider those as our core muscles. But there is a very specific differentiation between core muscles, where we have something called as inner core or the local core and the global core. So the global core is your superficial muscles, which are the abdominal muscles which we exercise while doing crunches in the gym. But evidence says that to stabilize your back or to make your back much more stronger, you have to stimulate or activate the inner core or the local core, which are very small muscles, and they don't kind of get stronger by activity. They get stronger by some cognitive activations, and when they are active, so before they are active, they are actually most lazy muscles in your body, so they are normally not active. You need to activate them. So like just pulling in your lower tummy is an core activation. So inner core, there are three important muscles. One is your transversus abdominis, one is your multifidus, which is around the back, and one is your obliques, not the rectus, the obliques. These three important muscles are the inner core muscles, which are responsible for your back stability. And now, if these muscles are active, then only you can actually focus on the global core, because global core is more dynamic and the local core is more static. So stability is more important to provide mobility. So we call it stability over mobility. So whenever you are advising any exercise form, you have to work on the local core, you have to activate your local core, and then only advise your global core movements whenever you give. Also, there is a big differentiation about how to prescribe exercise and which exercise to be prescribed. Like, do you want to prescribe? So a lot of people do crunches to reduce their tummy fat. It's a misconception. The tummy fat doesn't get reduced by doing crunches, But again, there is grading system in your muscles. Like back extension has a grading from 0 to 5, where 0 is minimum and 5 is maximum. Similarly, your abdominal muscles have grading system from 0 to 5, where 0 is minimum and 5 is maximum. So it is normally recommended that when your back strength is around grade 4, you can load your abdominal muscles with a grade 3 activity. When your back strength is grade 5, you can load your abdominal muscles with grade 5 activity. And now when you go to the gym, most of us, if you see this crunch is given like this. This is actually a grade 5 crunch for the abdominal muscles. And all the people who are there, they are normal. Average Indian population back strength is grade 4. So all these crunches normally put strain on the spine, and if your local core is not active, that absolutely pops out a disc from your spine, and then they have to visit Dr. Priyank. So you need to make sure that your back strength is good. Then only you prescribe the activity which is more graded towards abdominal strengthening. We normally prescribe more body weight activities like planks, side planks, which helps to activate the local or inner core rather than the dynamic activities.
So great. Dr. Chashnal, would you like to add something before I go on to the nutrition?
Yeah, so I'll just continue slightly with Dr. Gorish. So a couple of things in the gym, like people work more on their rectus and they don't focus on the glutea and the hamstrings, which are equally important. And many a times you will see they even in the gym people push to stand with exaggerated lumbar lordosis, which causes a lot of anterior pelvic tilt, and it totally disrupts the biomechanics while walking. It disrupts our posture while sitting, walking, as well as the anterior pelvic tilt is just not the good way for maintaining stability, as like Dr. Gorish mentioned. So, and it is very common in kids also nowadays. So they also have a lot of problems with the pelvic stabilization. They stand with tummies out, and it's not the right posture. So I think apart from the core, also focusing on like the anti-gravity and gravity, we need to balance the agonist and the antagonist muscles equally while working out for adolescents as well as people in their 40s and 50s as well. So that's an important point from biomechanical.
Great. So, Doctor, okay, Rajeshri, I'd like to ask you one thing. See, always, everybody asks me dry fruits, handful of dry fruits, and then they'll ask me, badam khana hai, to soak karke khana hai ke nahi? Fruits, subah ko khana hai ke sham ko khana hai? So, all these kind of things, there are a lot of people who say, I only have fruits for dinner. Some people come and say that fruits should not be had for dinner. So, would you just tell us a little bit about, exactly these do's and don'ts and myths and all that?
Yeah, so first of all, we dry the fruits and then we want to soak them and make them wet again. So the trick is really what nutrients we are going to get from them. So eat it as is, carry them as easily that you can. That's the whole perspective of making it dry. So start your day with a fruit is also good, but I normally after our workouts, what I recommend is that. Through our workouts, one very important thing I wanted to add was that hydration is very important. So, you're going to sweat a lot. So, you lose electrolytes as well. You could do a electrolyte drink with it, or you could at least minimally hydrate with water because your cells need the hydration. So that's something which we absolutely need to focus on. Post that, what I recommend to people is that if you're having you can have a protein diet where all the recovery happens and with protein though for an example you have eggs the way you like it, but ideally have a boiled egg. With that you should balance it out with vegetables and some amount of carb porridge. So you're doing a balanced component, trying to give a higher protein intake along with it, so you stay focused. And then maybe around 10-11ish is when I normally recommend a fruit. So reasons why, because that is the time you need energy. Plus fruits are a good source of antioxidants. So through our busy day, it's good to have them. We get exposed.
Also vitamins, no? Also vitamins, no?
Yes, yes, of course. So we get exposed to lot of allergens, lot of stress. So all through that, foods are actually good. They give us a sugar bout also. So they keep us active. So they are very useful at around 11 o'clock. Another thing is also people feel very hungry at say around 5ish. So that time is a good idea. Instead of going and eating a pani puri or a vada pav, it's a better idea to have a fruit, and that is the time if you can have dry fruits along with it. That's also good. But at that time, you could balance it out with a sprout. You could take a bale. You eat a bale, but eat a sprout bale. So it's very easy to carry along, easy to make it and take it with you, and you can't complain that you're not going to be able to eat it. It's just using a spoon and eat it. So these are the normal recommendations. Apart from that, it's better to avoid any amount of sugars in the night, right? You don't want to eat high calorie diets in the night because you're just going to go off to sleep after that. So uh, avoid it. And it's again, I'm sure ma'am can add to it. Even if it stays within us, you have to burn it out. So the idea is intake, how much the input versus out.
We always stress ours is
And
a millet country. I mean, traditionally, our food is so much based on millets and all what we used to eat from the beginning, Jawari, bajra, nachni. This is what we were traditionally eating. And like we had very few of these kind of things which we see nowadays, these problems. So, Dr. Menon, madam, I would come to you regarding, a lot of people come to me, especially I have a lot of women who are menopausal, perimenopausal, diabetic. So they say we are losing muscle mass or there's severe fatigue. And since you give a lot of talks on muscle, and so would you like to tell us a little bit about that?
there are certain things which we must know. During menopause and aging, we lose muscles. And if we don't we are not careful with it, we can go into various stages of, total loss of muscles also, which makes our bone more prone to fracture and other things. Fall itself is prevented by good exercise. Regular exercise is recommended. One of the reason is fall can be prevented by that. So what do we tell them when the menopause approaches? They need to take vitamin D and calcium because the requirement increases and the exposure to sunlight takes longer time for a menopausal older person as compared to a younger person. If I get my vitamin D in half an hour at the age of 25, now I'll have to do more than an hour to get the same vitamin D. So maybe vitamin D calcium supplementation is required. Exercise also benefits quite a lot of menopausal symptoms. When you're regularly exercising, stress and all these hormonal movements because of the vascular importance which it has. Something which I want to tell you, what does exercise do in terms of endocrinology? It exercise produces what are called myokines. Myokines are peptides which are secreted by muscles which have autocrine action, paracrine action, as well as endocrine actions. It increases the BDNF in the brain. BDNF is a substance which stimulates the hippocampus and it increases neuroplasticity. That means neuronal regeneration is better when you have higher levels of BDNF. Your cognitive functions remain good for a longer time. So that means it can be used to prevent Alzheimer's and all kinds of dementia. And generally, it is recommended to prevent the same. Second part is that it produces IL-6, which has effect on diabetes and metabolic produces because it reduces insulin resistance. The same IL-6, which in rheumatoid arthritis is in large amount and creating problem, when secreted by muscles during acute bouts of exercise, produces a very good beneficial effect in terms of insulin resistance. And a good muscle prevents diabetes, and obesity going into diabetes can be prevented by good amount of exercises. Then another thing which I wanted to tell you about this is that BDNF told me and survival. There are several other conditions which is prescribed. They're saying that for depression and other psychiatric problems like anxiety, regular exercise improves the situation and also the drugs required for that. Having said all that, there are some genetic aspects. Should I say that now? There are some genetic aspects to need. There are some people who don't like to exercise, and there are some people who like to exercise. It is said that this trait is inherited mainly from the father. Fathers who are exercising have children who are better exercising as compared to fathers who are not exercising. There is something else with mother. But similarly, any amount of exercise, the amount of exercise which is causing the muscle, result in the muscle increase in the strength and the muscle mass, is going to depend again on your genetic factors. Everybody does not get the same results with the same amount of exercise, which can be different. And so though there are genetic factors, these are like obesity and diabetes. They are multifactorial, and hence one single factor is genetic. There are enough environmental factors which will help you. So you continue exercises, you will certainly get benefit. Third, in the field of exercise, there's a lot of work which is being done to find out what are these myokines and what can help in terms of patients who have cachexia due to malignancy, because they cannot exercise. So what can be given to improve their muscle mass and certain things. For example, IL-6 was tried in a person with exercise, and they found that only giving IL-6 didn't work. They had to do 2-hourly physiotherapy, and then the muscle mass started increasing. So the increasing muscle mass and cachexia is important to improve the outcome of the disease as well as benefit when they come out of the cancer. So there is a lot of work which is going on in genetic aspects and all these things in terms of exercise and muscle mass.
So all these tips which we have got, basically these are relevant to everybody. They are relevant to us also. It's not for patients, but for doctors. Basically, this whole session is more about how we can benefit us, the doctors. So anybody would like to say something more which can benefit our fraternity, especially those of us who are a little older, not in the 30s, but maybe more than 40. So anything which we could, add to this, which can benefit the doctors, the doctor community.
Try and do exercise wherever you can. For example, you come to Jupiter Hospital, don't take the lift, climb 1 story at least, minimum. Wherever you get that chance, even in your building, try and take 1 step this thing. The thing which I really want to tell doctors is to eat on time. So you are controlled by the sun and the entire atmosphere, and we think we are a separate entity from the nature. No, we are part and parcel of the nature. And when we wake up until we sleep, the sun is going to decide. Early morning, all the hormones have gone high. The body is preparing to do well, and by evening, body is going to retire. Now, this cycle of the cycle which is there, that there is a clock which is situated in the hypothalamus. You have to respect it and try and behave accordingly. You get maximum benefit out of most of these stressful disorders would be gone away if you can follow those timings. Number 2, eating at 2 o'clock and 3 o'clock at night is not acceptable. Many of our patients do that because they are in the digital world, technology. So they do that. So that is something which is extremely upsetting because we don't know how to correct them. They do change, but they do come across with various disorders because of that. So that would be one thing. And as doctors, we should start somewhere to do some exercise. Let others also say something.
Yes, ma'am.
What about motivation? Because like Charsnal, you have a busy practice. Where do you get the motivation to exercise? How do you keep yourself motivated?
You need to unmute.
You exercise every day, and that is enough motivation.
I at least try to do thrice, and I don't book any slots for appointments during that time. I have made it a point because if we don't take care of ourselves, we can't take care of others. So
you have to
I
be
think we
fit
have
to
to be
look
little
after
strict,
others. Yes.
and I take a break. I have a gym which is close to the hospital. I take a break, I walk there, and I do different workouts over the week and a more longer workout on Sunday if possible. So I think we have to just motivate ourselves.
I think announcing your targets is a good way of going with it. Like you go in the lunchroom, you have all the doctors over there, and you just announce that I'm going to run the Bombay Marathon this year.
Yes.
Peer pressure helps you. Then you want to prove yourself, and that is a way by which you can kind of.
I don't think nothing ever works except that you go and start. See, when you start exercising every day for 3-4 months, that motivates you.
Yes.
Because you miss it.
Actually, in fact, ma'am, what you're saying is a theory that has been out there that if you do a particular activity for 90 days, it becomes an habit. So
Yes.
then your body just gets used to it. So brainlessly, if you want to get into an exercise form, pick whatever you want to do, even if it is for 15 minutes, 20 minutes, put your head down and just keep doing it. And as you hit the 3 months mark, suddenly you'll realize that it's become addictive and you cannot live without it. So
No,
that's
no,
actually
no.
a theory.
No,
So you
Priyank,
the body
you
gets
have
used to it.
benefits which is unimaginable. I used to
Yes.
have every time moches, what we call, no, ankle and knee and all that thing. And one of the orthopedic surgeon, Dr. Lahiri, advised me, please start go to gym and this will help you. This part will go away. It is really gone away forever. I do
And
Absolutely.
not get those cramps and other things which I used to get. My skeletal muscles were always the problem for me. That was the only thing which was a problem in country. But that went away totally by regular exercises because of the strength of the muscle. Simple as that. It doesn't
Absolutely.
get
okay, so
twisted very soon, you know.
yeah.
So
So
once you
Rajeshri, you
start
wanted to
getting
say something.
the skin
Rajeshri, there's
improves, the skin
one question.
improves,
Hmm.
lot of things improve. I think you will also agree with me. Your skin
Yes.
improves, a lot of benefits on that exercise. And when you have done it for 4 to 5 years, you see the benefits, you know when it is going away when you stop. Yes, that particular fact should be told. If you keep on exercising, you stop the exercise, within 2 to 8 months, all benefits are gone.
Yes, Rajeshri, there is a question in the chat box regarding soya chunks.
Yeah.
And phytoestrogens are plenty in that. So, like, how does one have it and in what quantity, especially even for children?
So the easy take on this is, I think that the question is in children again. As long as it's not the age of puberty, there isn't much to worry. And how much are they going to consume? I mean, at the end of the day, eating soya chunks is, how much can you consume out of
Right.
it? But so it's not so much of threat really in children. However, having said that, it should not be out of proportion. And why eat soya chunks when the children can actually eat soya bean itself?
Okay.
That can actually be, if it's less processed, always better. But
Okay.
I also wanted to actually add to the, like you said, some of these suggestions. I really, really think when we are doing exercise, and it's pertinent to women more, that, we always experience inflammation. If there's inflammation, then there is pain. And if there is continued inflammation, then, no matter how much of motivation we have, that can sort of, keep us back from going out there and exercising and pushing us further up. So, a couple of recommendations there, like there was a discussion as to, if there is evidence around. There's a lot of evidence from AHA which talks about, about the omega-3s and EPA DHA, consuming EPA DHA every day can actually be great for people who have, comorbidities. But otherwise, also, if you're trying to do strenuous physical activity, it can keep the inflammation low, especially in women who are, perimenopausal kind of situations. Apart from that, I'm stressed on whatever you eat has to be digested well. If it doesn't, again, that's going to add inflammation. It's going to give inflammation to your GI tract, and if the nutrient uptake is not good, then no matter how the physical activity to be more successful, it's finally what you're putting inside you. Apart from the fact that not everyone is genetically blessed like Dr. Sandhya out here.
Oh,
No,
no.
I'm sure she has a lot of effort to it though.
I worked
But
out. I just did a tennis championship. Okay, so now one quick, because I think we're running out of time. There are 2, 3 questions, Rajeshri. I think to you, green tea. There's all the green, blue, all this. I remember Rutuja Divekar once saying all this tea is all like
Antioxidant.
Yeah. So just tell us about it, and also, Gauresh, what is this moderate exercise? Somebody wants to know what is moderate. So first we go to the green tea. Then what is moderate exercise?
So green tea, there is enough that is published about the catechins in green tea, the antioxidant effect of green tea. And so, also the good part of drinking green tea is then you avoid milk teas and any other heavy drinks that you're going to have. So, having a green tea is healthy. Again, don't super overdo it, but yes, the catechins
Yes.
are proven to sort of help in obesity, also in liver health. So, the wheat is actually.
Yeah, and people have asked about milk also. So, somebody's written that it should be avoided and kept away, but I guess our panelists say milk is not such a bad thing after all. So
It's
we leave it
one of the proteins that vegetarians can have,
yes,
And apart from that, in the older age group, good amount of calcium. Calcium is best absorbed from milk rather than from any other preparation. Your tablets only 30% is absorbed. But when
yes,
you have whatever milk calcium comes in, everything is absorbed.
yeah,
That very great difference.
Two
yeah.
things to
So
add
that,
there is one,
yes,
as a baby, what did you have first? Milk. So,
Milk, correct.
how can it be bad? Second thing is,
Correct.
if milk you are not able to tolerate, try to have paneer and
Dahi,
and things like that. So, at least,
dahi and ice cream and all.
yes, yes.
Abhi Rajeshri, just one thing, which is everybody keeps asking this: what is intermittent fasting?
Ah.
I mean, is it okay or not okay? Just yes or no.
Intermittent fasting is okay. So it is okay to give rest to your system.
Okay. Yeah, I guess ultimately, like Madam said, it's caloric restriction which works. And what you said is even your system needs to, because you're overloading it every fine day. So Gaurish, just tell us, what is this moderate? Some people wanted to know what is mild, what is moderate, what is high intensity. We know what is mild, just start walking. But what is moderate? Yeah, you need to unmute, please.
Yeah.
Sorry. So actually, when we prescribe exercise as doctors, we have some scales on which we measure. So there is something called as box scale on which we measure the rate of perceived exertion. So it's like a 6 to 20 point scale where we come to know that when a patient is doing a particular activity, how much are they getting tired or how much breathless they are getting. So we ask them on that scale. So around 12 means on that scale around 12 to 13 is moderate intensity exercise. So box scale is one of the good indicator for finding out what intensity you're doing. Other important indicator is your heart rate max, like it is calculated 220 minus your age maximum heart rate. So moderate exercise would be something exercising between means exercising at a rate where your heart rate is 60% of your maximum heart rate. So that's something which is moderate exercise.
Great.
So,
Dr.
Gaurav, just to continue, lot of like all doctors probably don't have time to go to the gym. So, is it true that it is mandatory to go to gym, or you can do exercise at home? And if at home, then what kind of exercise you recommend for doctors?
So yeah, of course, it's not mandatory to go to the gym. In fact, when you're starting with exercise, ideally nowadays there are so many body weight exercises. Using your own body weight is an exercise. So you can do a lot of body weight exercises at home, but also high intensity exercise. The way you said, on a stepper or on a stool at home, if you want to do a good high intensity exercises, those are recommended for doctors at home. So you can start with initially calculating your rate of perceived exertion. You can calculate your maximum heart rate, divide it, come to 60%. And when you're doing high intensity exercise, make sure that the heart rate doesn't go to 60% of maximum heart rate to be safe.
I would like to know what you orthopedic people think about aerobics, fast walking. You know that walk of Leslie Sanson.
So, ma'am,
I love it. I love it, and that's the only thing which reduced my tummy. Nothing else would. Not even abdominal crunches, but that did.
Correct. So, in fact, there are a couple of things that have started coming up regarding this. So, one is the walk part that you're saying is a type of HIIT. The concept of high intensity interval training is where you push your body non-stop for a particular period, 20-30 minutes, which is going to raise your heart rate, which is going to give you the cardio benefit. It also involves exercise
It's
which
a
are vertical.
cardio. It's a cardio.
It's a cardio plus strength training because it involves a lot of it simulates bone growth. It's anti-osteoporotic exercises. So in fact that is HIIT. HIIT is a combination of burpees, jumps, resistance exercises done within a period of 30 minutes. And the one that you just mentioned is actually a very excellent way for people to start at home. Someone just right now also spoke something about yoga, and they just said that what do you think about Surya Namaskar? Well,
yes, that's very good exercise.
It is absolutely a very good exercise. The only thing is that there are exercise is a science. So you have CrossFit, you have got conventional gymming, you have got kettlebell, you have got HIIT, you have got yoga, you have got Pilates. What we recommend is, if you want to do yoga, stick to yoga. If you want to do HIIT, stick to HIIT. It does not make sense that one day you go to the gym and take dumbbells for your biceps and for your shoulders, and next day you do Surya Namaskar, and the third day you just go for a 1 hour walk. Pick your exercise form, because every exercise form has got different levels of increments. So if you do yoga, go with a good yoga guru or a learned yoga trainer, not the fancy thing that has started everywhere, because lot of people are misusing the term yoga. And upgrade your exercises, start with the basic levels and then gradually increase. So pick your exercise form and stick to it. Surya Namaskar is a very good exercises, but believe me, if suppose someone has got cervical spondylosis and without fixing cervical spondylosis they do Surya Namaskar, they are in for a toss. So there are so many different things that are out there. So pick any exercise form that you like and stick to it, and gradually upgrading the exercises.
So I'll
The
just keep
ADS sort of recommended the 3 days of this aerobics and 3 days of resistance training is ideal for
Absolutely, ma'am.
most of
Yes.
the conditions,
Yes.
especially diabetes.
And
Perfect.
rest day, very important that you have to give rest to your body one day.
Rest.
Why?
Yeah.
Why? Rest of the time you're resting.
See, I think we should just sum it up, because I'll
Okay,
just speak
yeah,
on
correct.
the yoga part, because I am practicing yoga since childhood. So Surya
Yeah.
Namaskar, of course, there's no exercise which should be done if you have a problem. First of all, that is
Yes,
understood,
yes.
that if you have a problem, no. But Surya Namaskar, she was asking the benefits. Benefits right from head to the toe. So I would just say it improves your circulation, improves your balance, concentration, memory. It improves your positive thinking, flexibility, elasticity, and it takes care of your joints. So Surya Namaskar is a holistic exercise. If you can do it, and if you do it properly, it has to be done with the proper breathing in, breathing out. It's not just fancy, 1, 2, 3. It's not like that. It's to be done properly, and then it has tremendous benefits. So that is one thing. And the most importantly, which I think everybody has touched upon, is mind training. You have to be consistent. You have to stay invested. Whatever exercise program, like Dr. Patel just mentioned, that if you do it for 90 days, it becomes a habit. So that's very important, because now I just started training after a gap for my tennis. And I realized, even 1 week I didn't go. I was like, literally, it was like becoming an addiction. No, I have to go. I have to go. Very important. Train with a group of people. So it makes
Good
you happy.
addiction, but good
Yeah.
addiction, but
When you train with a group of people, it makes you happier. And I think,
yes.
it improves the longevity of the exercise regime. So I guess that's it. And if anybody has if we have a couple of minutes, then anybody has one last take home point or one line, if anybody would like to sum it up.
Dr. Sunday, I would like to say, together we can.
Yeah, great. Excellent. Yes, madam. You said blame it on the genes.
Yeah, you can't always blame it on the gene. Even diabetes gets blamed on the gene, but gene is only this much. Baki ka karo.
Okay.
So I would probably like to end this on a very polarizing note, because we have had a 1 hour intense discussion on different exercise form, different nutrition, different supplements. I would say that do everything in moderation, because we are still evolving. We don't know what is going to happen to people who are doing too much exercises. Do everything in moderation, because I have seen people, and which madam has already said, being active is important, eating well is important, eating a well balanced diet is important, eating seasonal fruits are important, because there's a reason why it's seasonal.
And seasonal food.
Don't overdo everything.
Anything.
I had my grandmom, who happily passed away at the age of 94, never exercised in her life, ate a well-balanced Indian diet till the age of 94. She used
No,
to
she
make
did
her own
exercise
tea.
which you didn't see. She
No,
did exercise
exactly.
which you
She
didn't
did,
see.
exactly. She till
You know,
the
she
age
was
of 94.
gardening the door बड़ा घर था, ऊपर
Exactly.
नीचे चलती थी, बहुत सारा
She
एक्सरसाइज
used to
उनका
be
होता था.
active, doing her
Yes.
active life. She
Daily.
used to take care of her own tea. She used to, water the plants. And
Yes.
till the last day, she was walking. So
Correct.
at the end, I would say do everything in moderation and live a happy and healthy life.
I think
Thank you.
sleeping is also important. We are
Very
all
important.
sleep deprived. That is the
Yes.
biggest thing. So many surgeons are operating at night. Of course, if it's an emergency, it's different, but elective cases at night, orthopedics. So I think sleep is very important. Please try and sleep those whatever 6-7 hours. Try and shut eye is very important. It really needs
Yeah.
human.
Respect
think-
nature. Respect nature and the dictates that you to sleep at night.
Yes. So I
And
And
we
not
would
think
like to
anytime, huh?
really thank our panelists, Dr.
Yes.
Gaurish Kinkre, Dr. Chasnal Rathod, Dr. Menon, and Rajeshri for the excellent inputs that they have given us and having taken time out in their busy schedule to help us doctors out. Thank you so
and
much.
thank
Thank
you,
you all
Gauri.
very much.
And
Thank you all
team
very much.
Umang.
It was
Thank
nice
you
talking to all of you.
Yes, the team Umang for giving us this platform
Yes.
and for having us with you. Thank you so much.
Sandhya, thank you. And I would like to thank Sandhya and Priyesh for all panelists. I think this was a good session. I think everybody liked. You can see the comments. It was pretty balanced discussion, the way we expected it to be. So thank you, Priyank. Thank you, Sandhya, for conducting it so well.
Thank you, Mukta.
And
Okay.
Mukta, we have only touched the basic minimum. There is so much more you can discuss. Yes.
Yes, I will hold one day CME for that. So
I
I
know.
think we'll end here on this